My name is Dr. Carrie Ann Hong, and today I wanted to talk with you a little bit about this idea of functional medicine and integrative medicine and how that applies to dentistry. So in a traditional sense of dentistry, we've always looked at patients and talked with them about whether or not they have gum disease or tooth decay. The idea of a more functional approach to dentistry is that we're actually looking at the whole body and trying to find the root cause of tooth decay. So not just looking at what you're eating and drinking and how frequently you're brushing and flossing, but actually looking at more of your whole medical history. So do you have high blood pressure? Are you prone to high blood sugars and things like that? So today what we're going to discuss is everything from kind of the evaluation of how we better evaluate our patients to determine whether or not they have conditions that could be contributing to their overall dental health, and some of the ways that we're treating that in the practice. So as humans, as we've evolved, we've become more accustomed to Western diet where we eat more refined foods and we're not having to chew as much. We also live indoors, so we're perhaps more prone to allergies. And the biggest thing is we're not having to actually chew our foods quite the same way we used to. And as a consequence of these things, our jaws aren't developing as well. An example would be in the primate period, we had wide open jaws, what we would call primate spacing, and there was plenty of room for the teeth. Our ancestors weren't prone to tooth decay. They also were not prone to tooth crowding because they had all this space. So as we've evolved and eaten a little bit different diet and not maybe had the same exercise, and our jaws have become narrower, it's become harder for us to have enough room for our teeth. So a lot of us have went through orthodontia, and the most common thing that's been done in the past in ortho is the removal of teeth, actually because there wasn't enough space and things were crowded, so the orthodontist would remove teeth in order to have enough room for everything to fit, teeth-wise. But while the teeth might be fitting, there wasn't actually the same amount of space for the airway. So when you think about what takes up our oral cavity, we have our teeth, we have our tongue that sits within our teeth, and if that space is less because we've removed teeth and kind of restricted everything, there's actually not as much room for our tongue. As a consequence, the tongue falls into the back of the throat, or doesn't really know where to sit in the mouth. And so as dentists will notice things like ridging on the sides of the tongue, or the tongue, when you look in the mouth, will kind of just sit in the back of the throat, not really have a lot of tone to it, or know where it's supposed to be. In an ideal world, what we call proper oral rest posture is we want the tongue actually to be resting on the roof of the mouth, behind the back of the two front teeth, and we want the lips to be closed. We want to be nasal breathers. If we're breathing through our nose, it actually allows the maxilla, the upper arch, to develop better. It allows for a wider arch form. When we become mouth breathers as children, it actually results in a more vaulted, narrow archway. So the goal here is that we breathe through our nose, we get nice arch development, and we don't remove teeth for orthodontic purposes. So some of the symptoms or signs of a compromised airway are things like thumb sucking, enlarged tonsils, teeth grinding, dry mouth, mouth breathing, a tongue tie, snoring, restless sleep, high blood pressure, heavy plaque and tartar buildup, red and bleeding gums, or teeth that were extracted for orthodontia. So one of the tests that we offer here in the office is the WatchPat, and I'd like to go over today some of the reasons why you might consider taking that test home with you and finding out how well you sleep. The first one would be is if you've ever ground your teeth at night. Teeth grinding can be a very protective mechanism for our sleep. It's actually a way that we kind of move the jaw out of the way so that our tongue has more space in the mouth. If you've ever snored in the past or currently, and you wonder how loud your snoring is or whether or not it's affecting your sleep, that would be a good reason to do the test. And the final reason would be is if you're tired. You wake up and you don't feel rested even though you've had a full night's worth of rest, or you fall asleep easily when you're watching television or as a passenger in a vehicle. those are all good signs that you might not be getting proper rest at night. So the WatchPat is a good way to diagnose how well your sleep is and how much sleep you're getting, how much deep and REM sleep, and just even the quality of the sleep, because it will tell you how long you slept for, whether or not you stopped breathing during that time, and if you even had any respiratory disturbances.
Hi, my name is Dr. Jerry Hong, and I'm going to talk briefly about sleep apnea, treatment options, and how we can diagnose it more effectively than just by going by patient symptoms. First off, sleep apnea is a disorder in which you plainly stop breathing off and on during the night. That's in simpler terms. Some of the symptoms that we see in patients that have sleep apnea are loud snoring, restlessness during the night, a patient might report. And the result of that is most often seen during the day when a person says, well, I had a long night's sleep, but I feel very tired. Or a person may say, you know, when I'm driving, I fall asleep quite easily. Or if I'm sitting watching TV, I fall asleep quite easily. Those could be signs of sleep apnea. We in our office actually have a device that we can use to test whether a person has sleep apnea or signs of sleep apnea, and it's called the WatchPat device. And it's a take-home device in which the patient takes it home. Very simply, it goes around the wrist, and there is a device that attaches to the chest about at this level, and the person sleeps with it. From that, we receive information that we can input into the computer, and the computer can diagnose or indicate how many times a person has actually stopped breathing. Treatment ranges anywhere from the gold standard, which is a CPAP machine, which forces air directly through the airway so that the person is receiving adequate oxygen. Many patients, though, are not happy with the CPAP machine because it does require this small little box that forces air through the airway, either directly through the mouth or through the mouth and nose. Other treatment options include making an oral appliance, which helps to open the airway. Another treatment option can be the use of nasal strips, Flonase, which helps to dilate the nasal tissues, and taping the mouth, forcing you to breathe directly through your nose.
Breathing is the one thing we do every day without having to think about it. And obviously there are two ways in which we can get in air. One is through our nose and one is through our mouth. Ideally, we'd like all of our patients to be nasal breathers. And the reason is when you breathe in air through your nose, it actually results in an increased amount of carbon dioxide, which allows the oxygen that's in your body to be released better to the muscles and tissues. When we breathe through the mouth, we actually take in more oxygen, but we don't release that oxygen as well to the muscles and the tissues. So one of the ways that we can achieve nasal breathing while we're sleeping is by mouth taping.
I used to have to sleep with a night guard at night because I grind my teeth, until Dr. Hong recommended that I start taping my mouth at night. She told me that lots of people can benefit from mouth taping. For me, it helped me stop grinding my teeth, and for other people it helps them with their snoring. And so in order to tape your mouth, you can use some Flonase and then also some nasal strips on your nose to help open up your nasal passageways if necessary. And then you'd simply take some surgical tape and just put it right over your mouth right before you go to bed. And the idea of doing that made me a little bit nervous at first, sleeping with my mouth closed shut. But once I started doing it, it really doesn't bother me, and now I do it every single night, and all it does is make you breathe through your nose instead of through your mouth while you're sleeping, and it made me stop grinding my teeth.
So while the WatchPat or an in-lab sleep test is the best diagnostic tool to figure out whether or not you have a sleep disturbance, there's actually some really great free ways you can find out how well you're sleeping. And one of the apps that we recommend is something called SnoreLab, which you can basically download on your cell phone, and it will tell you how much you snore, and it will actually give you a volume reading as well. So that's an easy way. Or if you have something like a Fitbit, that also gives some baseline information as to how well you're sleeping at night.
I wanted to find out how much I was snoring. So I downloaded the app SnoreLab. It turned out to be a very significant device in finding out how much I snored and how significant it was. Snoring is associated with sleep apnea, of which many people have it and they don't get a good night's sleep, and then they're tired during the day, and it causes all kinds of problems. SnoreLab is very easy to use. You simply download it from the App Store, turn it on before you go to bed, and in the morning when you wake up you can see how much you snored, how long you snored, the intensity of the snoring, and you can do it multiple days in a row and compare your results.
So there's a test called MyPerioPath, and it's a saliva sample, and the test tells us how many bacteria you have that are considered problematic for periodontal disease that are at levels that are of concern. So this test is recommended to do if you have bleeding gums or any kind of inflammation in the mouth that's diagnosed as periodontal disease, because it lets us know whether or not there's a bacterial component related to the inflammation. And once we do the test, we're able to give better recommendations as to what kind of treatment you should pursue. So we can make Perio Protect trays, which are kind of like a mouth guards that you wear on the top and bottom. The trays actually extend over the gum tissue, and you put a hydrogen peroxide-like gel in the trays. With extended use, it actually can reduce the inflammation and the bleeding of the gums and remove the bacteria. Tongue tie is one of those things that a lot of people have and they don't even know it. It's when the tongue is tethered to the floor of the mouth, and it's important to address because if you have it, it can affect your airway and it can also affect the position of your teeth.
Hi, I'm Dr. Chrissy Tapp, and I wanted to talk with you today about tongue tie and myofunctional therapy. Several years ago, when I entered my 40s, I started to notice changes in my sleep patterns. I started to wake up in the middle of the night, my heart was racing, I would wake up feeling unrested, and I just couldn't really pinpoint what was going on. And so after seeing a speaker at the Spears Institute discuss sleep apnea and airway and how important the airway is to proper sleep and a healthy lifestyle, I started to see a pattern in my own life about my own sleep apnea. I had many of the things that he had discussed going on, and so I decided when we came back to the office after being at the continuing education course that I would undergo my own sleep study, and I came to find out that I have mild sleep apnea. I came to see that I had a tongue tie that was tying and tethering my tongue to the floor of my mouth and in my throat so that my tongue could not rest in my mouth where it belongs. And as we age, particularly women age, there's changes in hormones and progesterone levels decrease. The soft palate tone will lessen, and the soft palate can also start to drop down. So the combination of the soft palate dropping, the tongue being tethered in my throat, really started to, I could see how my airway was closing off and I needed to figure out what to do. So I started doing myofunctional therapy exercises with a myofunctional therapist to increase the tone of my soft palate and my tongue. And I went through the tongue tie release procedure. Several weeks of exercises, myofunctional therapy exercises, should be undergone before the procedure. At least 3 weeks of exercises to strengthen and tone the muscles of the tongue, and a follow-up for a full year of myofunctional therapy exercises is recommended. Research has shown that more than 50% of patients, adult patients with sleep apnea, will have a reduction in their sleep apnea from the myofunctional therapy exercises, and 62% of children will have a reduction in sleep apnea with a year of myofunctional therapy exercises.
Our goal here today was to help address what functional medicine and integrative dentistry can do for you as a patient. We're really trying to help with prevention. We are aiming to find the root cause of the things that are causing your inflammation in your mouth and your tooth decay, and addressing those by sending you to the right places. So whether it be a doctor to have a whole body workup done, or here in our office to have more frequent teeth cleanings, or to have a dental appliance made, or myofunctional therapy. We're trying to find why you have these conditions and what we can best do to help you prevent them.